Welcome back, everyone. Talking about mental health, and we have with us Amanda Bracht with the Mental Health Cooperative. I think people think you're a councilman. You're not a councilman. No. You're with the Mental Health Cooperative, and Inspector David Imhof with Metro Police Office of Alternative Policing Strategies. You wanted to talk about faith-based communities, how churches can help, right?
Absolutely. I think, we are in a city and a part of the country that, people often go to church to seek help. And one of the things we've seen in the last few years is church leaders becoming more educated about mental illness. I've spoken to several groups of ministers and clergy, and they're wanting to be educated on signs and symptoms and then what they can do when they identify within their church congregation somebody that needs help. So for those individuals out there who they're not comfortable talking to a mental health clinician, go talk to your minister, go talk to your pastor. And often, they can help calm the situation and then help link you with proper resources. And if you are in the clergy out there, there's contacts at the Department of Mental Health that are really trying to provide ongoing education for the faith-based community.
Such an important resource. And bottom line, what do you want people to take away from all that we've talked about tonight?
Well, for me, I just want people to think that, yes, there's an issue out there. We need to address it as a city, as a country. I'm super hopeful, actually, because we have programs like this, and we're seeing programs like this develop across the country, and we're seeing city leaders and community leaders recognize this is an issue. What can we do? And when that really counts is when you're willing to put money behind programs. And it's funny, I go to some community meetings and talk about the program as well as the other programs, and I have community leaders and I have councilmen and women come up to me and say, what do we need to get this countywide tomorrow? And this is one of the few times it's not like, hey, I need money. Actually, the mayor's office has been super supportive of this, and there's funding. There's funding to expand. It's a matter of getting clinicians. We talked about it earlier. There's a shortage of workers in this field, and we need more. So we need to do a good job of going out, and this is a new career path within this field. There's not a lot of people graduating with their masters thinking, I want to ride in a police car. One, they don't know about it because it's new. So we need to do a good job of going around to all the universities and promote the program and talk about the program so people think, hey, that sounds interesting. That's something I like to do. I like to be at the tip of the spear of dealing with people in crisis.
And that's what this is. And it's great to see that it's expanding. What do you want people to take away? And you have some information also if people have other questions, but what do you want people to take away?
I really want people to take away that, A, it's okay to talk about mental health. And let's take down the stigma of asking people, how are you feeling? Are you depressed? It's okay to ask questions about that, and that there's places to get help. We have great resources, as Inspector Imhof said, in the city. We're very fortunate that we're resource rich. I know sometimes it doesn't feel that way, but we truly are. We're blessed with many resources. So if you need help, there's the numbers that are going to be up where you can call the 24-hour crisis line and get connected to care. And also, again, just don't be afraid to check in on your loved ones and ask some of those difficult questions. They will often be very grateful that you did.
There are the numbers. So what is that? Mental Health Cooperative?
Mental Health Cooperative, yeah. The Crisis Center hotline, that is the 615-726-0125. 24 hours a day, 7 days a week. That is answered.
That's great. And I opened up by asking, okay, if there's someone out there with a loved one they're concerned about, what should they do? And I liked your answer. It was pretty simple. Ask them. First of all, just talk to them, right?
Right, absolutely.
So, very good. Okay. Final minute, what do you want people to take away again? Obviously all that, but talk to people. And we're making progress.
We're making progress. And, I think it's really important to know that we are making progress in getting programs like this and other programs out there, the counselors in the school, that there is hope out there. And I think we will continue to move the needle forward as we look at how to treat mental illness, just like we treat medical issues. And that's what we really have to look at. It is a medical issue that we should be ashamed to talk about and to treat.
Yeah, some very good comments on Facebook. We need more help in schools. You address that. More help for those that are homeless. So several good comments on Facebook. We will take a break. We'll come back, wrap everything up right after this.